All right, let's talk about something we don't often talk about. If you're a man over 40, you might have noticed some changes in the plumbing department. Today, we're going to pull back the curtain on all of it. We're going to get into what's really going on with male urinary complaints, and we're using the official 2024 guidelines for general practitioners in the Netherlands as our guide. Let's jump right in.
First things first, if any of this sounds familiar to you, you are so far from alone. Look at this number. Up to 1 in 4 men over the age of 40 are dealing with this stuff. So, right off the bat, let's be clear. For a lot of guys, this is just a really common part of getting older, not some automatic sign that something terrible is happening.
So, to make sense of all this, here's our game plan for today. We'll start with how common this is. Then, we are going to tackle the biggest myth out there, the prostate. After that, we'll look at what your doctor's actually looking for, the powerful advice you'll get before any pills are even on the table, the real story on medication, and finally, the really important part, when you absolutely need to see a doctor.
Okay, Section 1, a very common problem. Just because these symptoms are widespread doesn't make them any less worrying or, let's be honest, annoying when they're happening to you. So what does the journey with these complaints typically look like?
This quote, straight from the medical guideline, tells us something absolutely crucial. There's no single predictable path here. For some guys, the symptoms come and go. For others, they might stick around but never really get worse. And for a lucky few, they can just vanish, all on their own. The key thing to get is that it's not always a one-way street of things getting worse.
All right, this next section is probably the biggest mindset shift in this whole explainer. For decades, pretty much every urinary issue a man had was just slapped with the label, a prostate problem. We now know that's a massive, massive oversimplification.
And you know what? Let's just get the biggest fear out of the way right now. The guidelines could not be more clear on this. Prostate cancer is rarely the cause. Why? Because the cancer usually grows in a part of the prostate that doesn't actually press on the urethra until way, way later in the game, if it ever does. So just take a breath, it's almost certainly not that.
So if it's not the prostate, what is it? Well, doctors now use this term non-specific urinary complaints. It's basically a fancy way of saying they see these symptoms, the weak stream, the sudden urge to go, going to the bathroom all the time, as a collection of issues that you can't just pin on one single bad guy.
And that's because we're not talking about a single broken part. We're talking about a whole system. Think of it like a finely tuned engine. As we get older, a few different components can get a little out of sync. Your bladder might lose some of its stretch, your pelvic floor muscles might be too tense, nerve signals can change, and then you've got other things factoring in, like diabetes, side effects from other meds, your weight, and even your daily coffee. It all plays a part.
Okay, so you decide it's time to talk to your GP. What happens next? Don't worry, this isn't about a bunch of scary, invasive tests right out of the gate. The process is actually a pretty logical, step-by-step investigation that's designed to be reassuring.
It really just boils down to these 3 simple steps. First, the conversation. You just talk about what's been going on. Second, a pretty straightforward physical exam. And third, you might be asked to gather a little bit of data yourself, maybe with a questionnaire or a bladder diary, where you just track your habits for a couple of days. That's it. It's all about building a clear picture together.
So what's the whole point of this evaluation? Well, it's not to go hunting for something complex and scary. The main goal is simply this: to rule out the small handful of specific, treatable causes. For basically everyone else, the focus then shifts from diagnosis to management.
Which brings us to what might be the most powerful part of the entire guideline, the advice that comes before prescriptions. This is what doctors are told to focus on first, because for most men, this is the most effective toolkit you can possibly have.
And what's really cool about this stuff is how much sense it all makes. Getting regular exercise, it seems to have a protective effect. Waking up all night long? Well, maybe try drinking less a few hours before bed. Feeling that sudden gotta-go urge after your morning coffee? Makes sense. Caffeine and alcohol can irritate the bladder. And things like pelvic floor exercises and bladder training, they're basically physical therapy for your urinary system, helping you get back in the driver's seat.
So the takeaway here is actually pretty profound. Before you even think about a pill, you have a huge amount of control. Your daily habits and some simple exercises are often the most powerful prescription you can get, period.
But what about medication? I mean, surely there's a pill for this, right? Well, this is where the modern guidelines tell us we need to seriously manage our expectations, and they are surprisingly blunt about it.
Look at this. This isn't my opinion. This is a direct quote from the guidelines' core messages. The effect is very limited. This is what your doctor is reading. The whole idea of a magic pill that just fixes everything is, according to all the best evidence, pretty much a myth.
This really shows the gap between what we hope for and what's real. We expect a pill will fix the problem, but the reality is the effect is modest, often so small you might not even notice it. We think it's targeting the root cause, but remember that whole system we talked about? A pill can only poke at one tiny part of it, like bladder function, while ignoring everything else.
This chart really sums up the whole modern approach perfectly. The foundation, the biggest bar by a long shot, is lifestyle advice. That is step 1, 2, and 3. Medication, it plays a much smaller secondary role. And invasive surgery, that's way down the list, reserved for very rare and specific situations. And now for our final section, where we're going to bring it all home. We'll do a quick recap of the key takeaways and, most importantly, we'll cover the specific red flags that mean you should stop guessing and go see a doctor.
So here are the 5 big ideas to walk away with. 1, this is super common. 2, it's usually not your prostate, and it is almost never cancer. 3, it's caused by a complex system, not one broken part. 4, lifestyle is your #1 weapon. And 5, medication is a backup plan with pretty limited firepower.
But in the middle of all of this reassurance, there are a few things you absolutely must take seriously. There are some clear signals your body can send that go way beyond these non-specific complaints we've been talking about.
And here they are. The guidelines are crystal clear. If you can see blood in your urine, especially if there's no pain, that's an immediate call to your doctor, and likely a referral to a specialist. Same goes for any sign of what's called an overflow bladder, where you aren't emptying properly, or if you have these sudden, repeated episodes where you just can't urinate at all. These are the red flags that need a professional look, no questions asked.
But let's end right where we started. For the vast majority of men, these urinary issues are a manageable part of life. They are not a sign of something sinister lurking around the corner. Having the right knowledge, not fear, is your best possible tool for navigating all of this.
So, I'll leave you with this one question. Now that you have this information, what's one conversation that might be worth having? Maybe it's just with your partner to let them know what's on your mind. Or maybe, just maybe, it's finally making that appointment with your GP, not coming from a place of fear, but from a place of empowerment. Thanks for joining me.